Hi, everybody. Welcome back to A Dose of Reality. This is episode 4, the Monroe County edition. My name is Abby Weiss, and today we're here with Jamie Drake and Chris Sorrentino, who are at the helm of the Carbon-Monroe Pike Drug and Alcohol Commission, leading the community-centered efforts to bring substance use disorder treatment to everyone who needs it. Jamie, do you want to start by just telling us your role at CMP and kind of what your day-to-day looks like?
So I'm the executive director of Carbon-Monroe Pike Drug and Alcohol Commission. I've been with the commission for 30 years, and I oversee all the operations within our 3 counties of Carbon, Monroe, and Pike County.
Jamie also is like a pioneer for bringing medication for opioid use disorder treatment into the counties. So I just wanted to give her a quick shout out there because that is incredible work that she's doing. And then Chris, if you want to give us just a quick highlight of your role here and what your day-to-day kind of looks like.
I'm the case management supervisor for Monroe and Pike counties. I do a lot of the authorization for funding for individuals for inpatient treatment. I supervise our case management units up here. We operate a 24-hour on-call, and I supervise that. So we have individuals that will call, getting warm handoffs from the hospitals, giving guidance to the workers when they're running into difficult situations so they know how to deal with that. Go to the jails quite a bit as well, meeting with inmates there, trying to get them to that next phase when it's time for them to be released and try to get them connected with the services that they need.
So what is that warm handoff program that you were talking about with the hospitals?
When an individual comes to one of our hospitals, whether it's the emergency room or one of the medical floors, they have a history of substance use disorder. They reach out to us. We screen and assess them, and we try to find the resources for that individual to get. So sometimes it's linking them to treatment if they're willing to accept that, or getting them linked to other area providers.
Yeah, I mean, you guys have both said it, and it really just kind of highlights stuff that we've talked about in other episodes. And it really is so important, just the connections that you're building when you're entering in a space of recovery, or maybe you're not so willing to get there, but the both of you have mentioned forming connections within the community, and that seems like a really big part of the jobs that you're both doing. Jamie, how has kind of the efforts for medications for opioid use disorder shifted throughout your time with Carbon-Monroe Pike?
So we began looking at medication-assisted treatment in late 2005 when the FDA approved the use of those medications. In 2006, launched some in-person work with doctors coming into our office. We've really pioneered a case management process to connect people and work with people to help also fund the uninsured individual to be on those medications who doesn't qualify for medical assistance. So
you guys can start that in correction facilities, correct?
Yes. So in all 3 of our county jails, in Carbon-Monroe and Pike County, we have staff that works in the jail who helps facilitate the case management functions and the treatment functions that go along with that. And then we work with the medical providers within the jail, Prime Care, which is the medical provider in all 3 of the county jails, who are the prescriber and make that final decision on what the most appropriate medication is for somebody.
Okay. So for people who don't know, can you just give us a little bit more background on what these what's their primary purpose? Why would people be taking them? And then what's the importance of them?
So in many cases, it's focused on opiate use disorder, although some of the medications also work for alcohol use disorder. And, again, these medications help to fill the receptors in someone's brain, and then it reduces the cravings to use. And they all work a little differently, and they come in various forms. So, each jail uses different forms of those medications, whether it be films or pills or a shot. And there's various lengths of time that each of those medications work for. And then the goal is to get them set up before they come out into the community so they can continue to take those medications at the very high risk time of overdose when they first leave the jail.
Yes, Jamie, you just said something. So I actually worked on a short research project at my time at Moravian, and I focused mainly on that critical period, which you just said. So the time of release from any sort of correctional or institution of some nature to the point when someone might consider using. And those couple days, couple weeks are, from what I understand, the most paramount. and your risk of fatal overdose in that period is substantially higher than any other point when you go from not using to using.
Absolutely. And Chris, you want to talk about what we do when people leave the jail as far as Narcan?
Yeah, so all 3 of our jails in our catchment area have requested Narcan from us. So we provide them with Narcan. Individuals who are willing to accept it that have that history of opioid use disorder will be given Narcan. Obviously, we don't expect an individual to give themselves Narcan, but they can give it to their families, or even if they are continuing their recovery and doing well, oftentimes those individuals are still connected or having some association with individuals that are active in their disease. So they have the Narcan on board as well.
Yeah, I think that's also super important. We've touched on Narcan before too. You obviously can't give it to yourself, but when you're in these environments where you're surrounded by other people, it's important that you have it on yourself, perhaps, or you're giving it to people that you're spending time with. So I think it's great work that you guys are doing that. How have you guys started to get creative in this outreach process? I know magnets were a thing at one point.
We've used a variety of mechanisms, and really, for Chris and I, we've always said, like, wow, no matter where we put this number, it still seems like people don't know the number to call when they need help. And, that's simply if you're not looking for it at the time, you may not, pay attention as closely to it. But we have, we've done magnets, we've done stickers, we've done gas pump toppers,
Shopping carts, billboards,
tear-off pads that go into doctors' offices, like similar to a prescription pad, posters out in the community.
So anywhere that the public would see them. I think it's cool. Like the grocery store thing is smart because most people are going to buy food somewhere. So anywhere that the public is seeing these things and maybe it resonates with them for a split second, just long enough for them to even take a photo of it.
Absolutely. And natural places. Instead of us, outwardly going, we're going to where people go, where people are actively engaged in the community. As well as our bracelets. We have bracelets that have our toll-free number on them for the 24-hour number, which we've provided to ambulance corps, to hospitals, to schools.
Okay.
And we go to a lot of different community events in the area as well. So community night that happens every year at Northampton Community College. We try to join in on when somebody else is having an event. We try to be there as well so that we can provide our information, Narcan, RX Destroyer, and just our basic information about how to get help.
Next week, we'll be in several locations in Monroe County on September 25th, which is Save a Life Day. It's
yes.
the national day.
Can you tell us a little bit more about that?
It's a national day for handing out Narcan in the community. So we do have several locations in Monroe County that we will be at that day, including East Stroudsburg University. We'll be here on Main Street, really, really close to here, 701 Main Street, I believe it is. Right. Usually, as well, there's some various other ones, Chris, you may be aware of.
Walmart. I know Walmart's one of the places that they're going to be setting things up. So it's just, and we do tend to get a good turnout. I know we give out quite a bit of Narcan during those days. Fortunately, I'm pretty well stocked at this point. But it's a great opportunity, again, for us to engage and provide the Narcan if people want it, but also to leave there knowing how they can get help for themselves or for their families.
And know that any time you could come to our office and get Narcan. It's not just that day.
That was
it is
my
any
next
time.
thing.
It is free. It is available to anyone in the community who needs it.
Yes. So you do not have to wait until September 25th to receive Narcan. It's available essentially whenever you guys are open.
Correct.
Perfect. So accessibility is obviously such an important part of this. And you guys have both said it, that people don't often know where to find help until they need it. And we don't want that to be too late. But you guys are getting out into the community in spots where people might not be looking for help and you're still there. How do you guys continue to do that work of like showing up when people aren't necessarily looking for it, but still continuing to provide resources? Like how has that grown and expanded over the years?
So one of the things we have an overdose prevention coalition, and we have a subcommittee of that called PROP. It's the Pocono Recovery Outreach Partnership, and it's built up of lots of providers and stakeholders in the community who go out and do this outreach, come up with activities to ongoingly look at different avenues to reach different people. They do some outreach to homeless communities. They've done the Pocono race every year where there's massive amount of people in Monroe County that day. They meet on a monthly basis and just really brainstorm what can we do next? What's a different way that we can get out there and educate people who need help? It really is a collaboration. It's not about us just as the single county authority, but, connecting to all the different organizations in Monroe County to see what we can do working together to serve the people that need help.
Yeah, you guys are doing incredible work. So thank you for that. Kind of going along those same lines, do you guys have like one point throughout your careers? I always like to ask this question that like really stands out as one of your most favorite moments or something that you look back on, I guess individually or just kind of as Carbon Monroe Pike as a whole, and you're like very proud of that moment?
I think for me, it's when I come across somebody that I've worked with quite a bit of time ago and they're still doing very well. Just had that happen to me a couple of months ago. A gentleman came into our office actually looking for Narcan.
Okay.
And we were looking at each other. We kind of thought we knew each other. Hadn't seen this gentleman in 15 years. He was one of the first people I actually worked with individually as a case manager. And we were talking. He was still doing very well. And this is a person who, when I first met him, was an absolute mess.
Yeah.
He was really in the grips of his disease. And 15 years later, still working the program, very involved in helping other people and taking on commitments. So stuff like that, that's what's great. Because you really feel like, you've touched somebody. Yeah.
And I know that there's days working in this field that are hard. But I know personally that moments like that make the job so much more worthwhile. And knowing that you're able to walk away from that person after that interaction being like, wow, I essentially helped save his life. And now he's 15 years down the line and is still doing well and is showing up for other people then. So that's wonderful. I love that.
Yeah, for me, it would be like, multiple times having that, working with somebody when they have that aha, I call it the aha moment.
Yes.
When, they're ready to go. And I know there's a small window to get them where they need to be. And it's like a challenge, like we're going to get them where they need to be. Whatever it takes, we're going to get them 24/7, whatever we need to do to get that person there. And then having Recovery Month come every year and celebrating with the people. Again, being here 30 years, I worked as a therapist originally when I started here at Carbon Monroe Pike. So I have clients that come back that have close to that time clean. So seeing what they've made of their life, it's amazing. And it's what gets us up every day and keep doing what we're doing.
Kind of going along that same line, I feel like so much of the year we spend trying to combat the opioid epidemic as a whole and just kind of like the negative sides of it, which there are a lot. So I always love when Recovery Month comes along and we're able to celebrate these individuals like on such a large scale. And even the people who are working in the field like you, Chris and Jamie, it's so nice to be able to have that month of essentially celebration.
It is. I mean, the work is hard.
Yes.
Our staff, they live everything with these clients. They live the overdoses, and when they've been here for a while, that gets to be very strenuous on somebody. So to be able to then see the positives and the successes, in this month, it is just the most awesome thing.
So you guys did also say that you're able to serve both uninsured and insured populations. Do you just want to talk a little bit more about more so the uninsured population and how you're able to still work with them despite that barrier?
What I will say first, and I'll turn it over to Chris, is that that's who we specialize in.
Okay.
We specialize in the uninsured, the folks that struggle to find any kind of way to get the help that they need. And really the message that I try to nail home to everybody is that don't think because you don't have insurance you can't get help.
Absolutely.
So one of the things that we're able to do is we get funding from the state that allows us to pay for somebody's treatment if they don't have health insurance. Now, we're always trying to get them on medical assistance, so the medical assistance will eventually cover, but that's one way we can try to reduce a barrier. So when an individual does not have that health insurance, we're still able to screen, assess their needs, and get them linked to treatment. But when somebody calls us, if you have the best insurance in the world, it's not like we hang up and say, call your insurance company either. We'll always try to link somebody to where they need to be. We have pretty good relationships, actually I think pretty amazing relationships with a number of different providers, some who only take insurance, but they're always in touch with us and keeping us aware of what they're doing so that we can communicate with them if I have that person with insurance. But if an individual doesn't have health insurance, it doesn't mean that they can't get help. They can definitely get help.
So where are these service and referral locations across Carbon, Monroe, and Pike counties? Where would someone go to if they are looking for help?
The easiest way is for them to call our toll-free number
Okay.
at 866-824-3578. We have, during the normal business hours, we have individuals down in our Lehighton office, and they will do an intake and do what needs to be done from there. After hours, we have somebody who's always on call. So again, it doesn't matter if it's a holiday, it doesn't matter if it's a weekend, it could be 3 o'clock in the morning. Our folks don't necessarily appreciate being woken up at that time, but they are going to help that individual as best as they can and try to get them to wherever they need to be.
Okay.
And people need to understand that we have contracts all over the state of Pennsylvania. So they're not just in our 3 counties. We do have contracts within our counties for people who want to stay local. But we have contracts all over Pennsylvania. And sometimes, in many cases, it's better for somebody to actually leave the area for a little while, focus on themselves, not have the distractions of being so close to home, and make it easy to actually leave, which many people have that risk initially when they go to services.
Yeah, I would imagine that it's terrifying for someone to, 1, make the commitment to go to treatment, and then 2, to make that commitment to go to treatment away from home. But there are obviously a lot of benefits to it. Jamie, do you want to touch on what some of those benefits of going to treatment and kind of not in your hometown or right here in the Poconos, what kind of additional benefits that someone would get from that?
So I think it's a mixed bag, and everybody's individual. And, in some cases, it makes sense for somebody to stay local, especially if there's a strong family connection.
Yes.
So that family can participate in a family program, which is very important because this is a family disease. This just doesn't affect the person with the substance use disorder. It affects their whole family. In many other cases, it's the distraction. If they do stay close and if they go somewhere where they can just focus on themselves and not any other distractions, worrying about what's going on at home, drama that may be happening in the family or work issues, as long as you have a supportive employer. There's so many variety of options, and each facility has different programs and different strengths that could meet that individual need of a person.
So as you guys are going through the assessment process and looking for treatment for individuals, it sounds like you take some of those factors into consideration prior to being like, hey, so-and-so, you're going to this program 4 hours away. We hope you're okay with that.
We always offer an individual a choice. Obviously, there's certain treatment needs that we need to address and recommend. So many people, it's not just a substance use disorder. There's also a significant mental health issue going on. Some facilities are better at addressing that than others. So if we have somebody who has that comorbidity, that fancy word,
Yes.
we we'll talk to that individual and help them understand that you may want to go here, but that's probably not the best place to address what's going on. We can line you up here or here that can better address that. And a lot of that is just kind of building up that trust with that individual that hopefully will listen to us, listen to our recommendations, and hopefully trust that we're going to place them in the right spot for them.
I just want to kind of reinforce the message that we just talked about. Treatment shouldn't, and currently in this environment, doesn't depend on an individual having insurance. So if you are in need of assistance, if a family member is in need of assistance, reach out because you're able to find help, whether that's through the toll-free number that Chris had just mentioned that we'll say again at the end. If it's through the website, if it's going into one of their locations, help is readily available for you. I just want to talk quickly about some of the broader initiatives. Jamie, I think this question is more geared towards you. So the immersive recovery simulation, so like a role play experience to help community leaders grasp the real world struggles of addiction outside of just that small scope. If you want to touch on those and just kind of explain what those do to benefit people.
Okay. So our recovery simulation was developed outside of our overdose prevention coalition, looking at ways that we could address stigma in our community. We started off by doing surveys, which we only got more angry about the results we got from the surveys. So we thought, how can we do something that people get the message but really don't know what they're doing at the moment, but at the end they go, yeah, that's it. So we developed this simulation. We took a poverty simulation and we tweaked it into a recovery simulation. And people go through 4 weeks as if in a life of somebody who has a substance use disorder and what they deal with when they're out in the community, going to different organizations, and all the multiple demands that are placed on somebody early in recovery when they're just struggling to find themselves. And we've had amazing results with this. People have, after one cycle, have started to cry and say, wow, how does anybody do this? Like, I'm healthy and I can't do this. How does somebody who's just trying to get clean do this? It has raised great awareness to the point that we've been requested all over Pennsylvania. We've actually provided it to the other single county authorities, and we go provide technical assistance to them. And we've traveled to other areas as well to provide these simulations. We've been asked to come as far as North Carolina.
Oh, wow.
And one of the ones we most recently did, we do the Northampton County Community College nursing students every year.
Okay.
And we did the Lehigh Valley residents, 60 resident doctors getting into the field. And we really target those people who are just getting into education and healthcare and social services to try to change their perspective before they're out in the field, to go in with a new perspective and how, they can treat people that are in early recovery that need support.
Yeah, I think that first impression that people might find. So if I were like walking into the doctor's office in early recovery and I'm not met with the compassion that the simulation can provide, that could be a pivotal moment to turn me back into old ways as opposed to continuing on the difficult road of recovery. What are some of the obstacles or barriers that people are facing in the early days of their recovery?
Well, the stigma is probably one of the biggest ones. It's one of the ones that oftentimes prevents a person from even wanting to seek help. Also, the stigma, oftentimes too, it works in another way because it prevents a person from even accepting that they have a problem. Because when you think about the stigma about who an individual is with a substance use disorder, we have all those negative thoughts, right? They don't work, they're dirty, they're grimy, whatever. So if you have a well-paying job, nice car, nice house, can't have a substance use disorder. So stigma is one of those big things. Obviously, not knowing where to go. Again, we're like flood remediation. You don't think about that type of service until you actually need it. So a lot of people don't know where to go. And many times when we get those phone calls in the middle of the night or during the day, and the first thing they tell us is, I've called like 100 places. And we try to make sure that we are the last place that they'll have to call, or at least if they are going to talk to somebody else, it should be the last. Transportation can sometimes be a barrier for individuals who are trying to get help.
Finding employment, stable housing. The cost of housing in our county is absolutely ridiculous. And, even when people get a job, they're only limited in the jobs they can get because of their criminal history sometimes. So what they make isn't enough to pay for a place to live, a good, healthy place to live. The multiple demands. So somebody, may just leave jail and they have to report to probation. They have to come to treatment. They have to go to mental health. They have to go see the doctor for their MAT. It's so many things. And they're spinning around saying, wow, how am I supposed to do all these things? I have no money to do them. I don't know how I'm going to get there. And may have very little support because they may have burned bridges during their active use. So, until those kind of things kind of get ironed out. And that's where, we take the simulation and we have a flip side to that. We also provide a case manager and a certified recovery specialist to walk around the simulation and support those individuals.
Okay.
To show people that there are roles that are out there that can help people when they are struggling with all that, feeling overwhelmed, to help make it a little easier.
Does Carbon Monroe Pike assist with the process once someone's in recovery? So I know that you guys have already mentioned the things that you provide when someone's getting there and being that first response kind of phone call. Are there like peer support specialists? I know, Chris, you said that you do the case management aspect. So what does that look like for someone who's in recovery at this point?
Case management is about focusing on the non-treatment needs. My look at it is that case management is just as important as the treatment part. You're talking about issues, whether it's housing, employment, life skills, budgeting, whatever it might be. These are the things that oftentimes trip a person and start them down that slippery slope to relapse. So our goal is to address those non-treatment needs, formulate a plan with them, link them to whatever services that we can link them to, and support them along that way. In terms of recovery support specialists, we do have a CRS who works with us. He works mostly with the individuals who are involved in the law enforcement treatment initiative through the DA's office.
Okay.
So his goal, kind of very similar, is just offering those individuals support, leading them to the right direction. If the individual needs more kind of intensive services, needs more case management, then he will link those individuals to one of our case managers.
We also do have CRS, Certified Recovery Support Specialist, contracts with our outpatient provider as well as one of our recovery houses to provide those services to individuals out in the community.
Okay. So you guys just mentioned something that I want to reiterate. Once you receive treatment, you are not then left on your own, to your own devices, to figure out how to actually get your life back together and formulate all of the pieces that so many of us take for granted, like housing and job and transportation. There are people who are willing to work with you and are happy to work with you in putting the whole puzzle back together.
And at any point in somebody's recovery, they can get case management. They don't need to be active in treatment. If someone is not ready to come into treatment but is willing to start coming to case management, they can do that. If they are in recovery and some issue comes up, they can still come to case management without having to engage in treatment as well.
Okay.
And it is a free service.
So there are not set steps that an individual needs to take in order to benefit from the services that Carbon Monroe Pike is offering.
Not at all. And the beauty about it is, like what Jamie was saying, it's not only just free. It doesn't matter if you have no insurance, Medicaid, or the best insurance in the world. Those individuals are still eligible for case management.
Okay. Good to know. Jamie, can you tell us a little bit about your role on the statewide Recovery Rising Advisory?
So Recovery Rising was an initiative. It has now completed.
Okay.
But really, it was to look at recovery supports and the way they're established and making sure that people across Pennsylvania had the access to recovery supports within their local community. From that, we developed a equity coalition here in northeastern Pennsylvania as the pilot for Pennsylvania. Which we continue to meet and continue to explore that, making sure that everybody has access to what they need when it comes to recovery support.
And then how did you guys, this is probably a question we should have started with in the beginning. I just thought of it now, though. How did you guys start in these roles? Like, what was your driving factor to enter the space of recovery and this community and providing so much to others?
When I got out of college, I think the population I'm working with right now was probably the last population I thought I was going to work with.
Okay.
But I ended up at Carbon Monroe Pike Drug and Alcohol. And when I started working with the individuals, I guess when I started initially out of school, I had some of those same stigmas. As I started working with the individuals, I really started seeing that, I was working with some awesome people. Mm-hmm. They're just being weighed down by their disease. And I loved, frankly, that I was working with folks that nobody really wanted to work with. And I, again, seeing those individuals on that personal level, who they were, what they were all about, and wanting to see them succeed. And 27 years later, I'm still here. So either I'm crazy or I'm committed.
Both, maybe.
Probably maybe both. But that was really it for me. Like, this was not the career track I thought I was going to take at all. But when I got here, it just seemed to all make sense.
And for me, I've been in the field for 35 years. I worked inpatient 5 years before. I've been here 30. And I mean, I've lived with substance use disorder since I was born, I say, with my father being an alcoholic and a brother being an addict. But I didn't intend that either. I intended to work in something in the human service field, trying to help people.
Okay.
And my internship, they couldn't take me like 2 days before. So they planted me at an inpatient rehab. And from the moment I was there, I was home. Like, I didn't want to do anything else. I've never in my life wanted to do anything else since that day. I love what I do. I love the people I work with. I always say, like, if they would just take their energy and their creativity, what they put into their addiction and put it into the recovery, they all could be amazing people. People have such a misconception that, again, these people, they must be dumb, they must be poor, they must be this, they must, and my favorite days lately have been going to the homeless warming shelter and just doing outreach.
Okay.
And trying to engage people and get them to trust and know that there's people out there that do care and will help them to have a better life.
I think that just really speaks to who you guys are and the work that you're doing. To not really even expect to get into this field, and then 15 and 30, 35 respectively years later, you guys are still here and you're still putting in the work. And for anyone who's listening and might need those services, there are people with decades of experience who want nothing more but to help you. And then again, they do have a 24/7 referral center that you should reach out to if you need it. Chris and Jamie, is there any last bits that you wanted to add before we start to wrap up?
It's never too late to try to look for help. Nobody's too far gone. And just because you've tried this before and it didn't work out, it doesn't mean that it can't work that second, that third, that fourth, that fifth time. We don't shut our doors just because we've seen you over and over again. We take you from where you are at that moment in time, and we try to help you make progress forward. So we do our best to make you feel comfortable, not feel ashamed about coming to us. We appreciate what you're trying to do, and we want you to get the help.
I always say it's like riding a bicycle when you were a little kid. One of us got on that bike and rode off and never fell. It doesn't matter how many times you fall up. They'll pick you up with you. We'll stand with you. We don't take credit for your recovery. We just stand alongside of you and help you get to where you're capable of getting, and believe that anybody can get there, no matter, like Chris said, if it takes 10 times, we'll be there 10 times. Holding your hand, making phone calls with you, doing whatever you need. We just got our shirts for our recovery month this year that says, when people ask what I do, I say, whatever it takes. And
Whatever it takes.
that's where it's at.
I like that. So again, everybody, 24/7 referral center. The number is 1-866-824-3578. That's 1-866-824-3578. They are willing to do whatever it takes. You can also find their website at cmpda.cog.pa.us. If you're in need of any sort of assistance, reach out, because you will be met with incredibly kind people who are more than willing to help you. Thank you, Jamie and Chris, for joining us today on the 4th episode of A Dose of Reality. Again, recovery is possible and help is just a call away. Thank you.